Hi, I'm Barrett.
And I'm Brandon.
And we are Bionicfitness.
Today we're going to talk to you a little bit about joint angles in your squat and knee traction, right? So we're going to start off with Barrett doing a bit of a demo for us in terms of squats. He's going to do 3 different squats, and I want you to take a look and see which one you think is the correct squat, right? So he's going to start off with a narrow squat with feet together, coming down. And back up, good. And he's going to give us a open 45-degree angle squat. Up. And he's going to give us a wider or a sumo squat here. All right, it was a bit of a trick question. Actually, none of those squats are incorrect. They all just emphasize different muscle groups, right? And the 2 muscle groups that we're looking at mainly are these. Do you want to give me a quarter profile here?
Oh yeah.
Perfect. Come on down. What's holding the knee into place here is 2 different muscle groups. Number 1 is the adductors or the groin muscles. Can you fire those up? That pulls your legs inwards. And the abductors or glute medians and TFLs, pull those. That pulls your knees outwards. Those are big stabilizers. For people who have anterior pelvic tilts, their adductors or groin muscles are generally fired up and pretty angry, which can cause problems through the knees. What is incorrect in a squat, though, which we really want to take note of today, is come on down, is when your knees and your toes are not facing the same direction, right? So right here, his toe, Barrett's toe is facing around here, and his knee is facing around here, right? That's going to cause twisting or torsion through the knee and put the ligaments at risk, right? You can't really repair damaged ligaments without surgery, which we obviously want to avoid. Also, what happens when you collapse inwards like that through your squat, coming down? As you can see, Barrett's ankles here end up collapsing, right? That stabilizing unit of his foot and his ankle are super important, not just for his squat and not just to stand on, but for his nervous system. And they end up collapsing, and that's super problematic also, right? When he does his squat, he wants to make sure that the knees and the toes are tracking in the same direction throughout the entire movement. So this is what we see often. Give me an incorrect one. We see lots of Elvis knees where they're wiggling in and out during a squat. This is really problematic, and we want to try and avoid that as much as you can. Instead, we're going to keep it nice and clean, making sure the knees and the toes stay in the same direction all the way through that movement. This is how to keep your knees nice and safe in a squat and making sure that you're emphasizing the muscle group intended throughout your squats.
Thanks a lot, guys. Happy squatting, and please, if you have any questions or comments, we leave them in the comment section below. All of our information is in the description. Again, if you should follow us on Instagram, and of course, email us if you have any other in-depth questions.
Keep those knees healthy during your squat.
Yeah.